Hey everybody, Dr. Sherry Berger here. Pleased to be joined today by a couple of colleagues. I reached out to Ms. Jen Shryock and Dr. Jill Sackman. And just for some context, had the pleasure of knowing and working with Jen Shryock for a little over a year now. VetVine partnered with Family Paws to produce a 4-part series to help inform veterinary and pet care professionals about this topic of keeping children safe in dog-owning households. It's officially titled the Dog and Baby Toddler Safety Program for Professionals, helping to inform us on how we can best support pet owners who have young families, children in the home, and dogs. I reached out to Jen on the heels of coming across a couple of news stories in the last month or month and a half related to the most extreme of circumstances around dog bites and outcomes, in that are dog bite fatalities. There was a story out of Tennessee in particular that tugged at my heart, the details that we won't spend a lot of time on, but it did spark a lot of curiosity in my mind about why these things happen. We realize that they're rare, and Jen and Dr. Sackman will share more about that here as we talk. But at this point, I want to welcome you, Jen, and Dr. Sackman. Introduce yourselves briefly. Tell us where you're coming from.
Well, I'm Jen Shryock. I'm a certified dog behavior consultant, and I specialize in dog and baby toddler safety and dynamics, and the founder of Family Paws.
Awesome.
I am Dr. Jill Sackman. I am a board-certified veterinary behaviorist, also a board-certified surgeon, and I currently have a referral-only behavior practice in Michigan, Animal Behavior Consultants of Michigan. I'm also proud to be a consultant, educator with Family Paws, and have worked with Jen for a number of years. It's been a great partnership.
Awesome. Well, I really appreciate you both taking time today. We are just a week before the Thanksgiving holiday. The holiday season is a stressful time for everybody, not only humans, but the animals in our homes. And so it's really a perfect time to be convening and talking about this topic. So I would like to lead off just with the question that I had sent to Jen in regard to this story out of Tennessee. And the news account is that these were loving family dogs. And it culminated, again, in these dogs attacking the children, and the unfortunate outcome of the children dying. My question, and Dr. Sackman, I think you're the perfect person to ask this question. I have a dog. I consider him a loving dog. How is it that a quote-unquote loving dog, a well-behaved dog, one that we're comfortable sharing our beds with even, could actually not just bite, but continue to engage with its subject and result in that degree of harm? Do we know factors that contribute to that?
Well, one of the things, Sherry, that I always tell, and I do a lot of family dog counseling in my practice. So I love it when I have families come before babies arrive. Sometimes it's after babies are there, or after babies have experienced a snap or a bite in the home. And one thing that I truly believe is bites don't come out of the blue, even though they seem to for families. There's been signs and signals and warnings that the family, friends haven't seen or have ignored, thinking they're not serious. I think it's hugely an awareness issue in most cases where there's been bites. I also look at the cause of the bite, or the reason for the bite can be quite variable. I don't know specifics about the circumstance, but I would say that I don't label dogs as aggressive. They don't get the aggressive label. I tell families I talk with, to say your dog is aggressive is like saying your dog has high blood sugar. It doesn't say much about what the reason for the aggressive behavior was. and we spend a lot of time together trying to understand. So how could this happen? My suspicion, and we know, Jen can jump in here too. We know most bites happen with dogs that the family is familiar with, and family dog bites are the most common. And there's probably been mixed signals from the dog that the family have not seen or not anticipated. Children, particularly small children, can be very scary for many dogs if it's a fearful dog, because they move quickly, unpredictably in the dog's mind if they're already somewhat uncomfortable with that sort of setup. A child moving quickly, stumbling over the dog, falling on the dog, pulling themselves up right into the dog's face can be incredibly scary for that pet. Every dog is an individual, just like humans. Some dogs may get up and leave. Some dogs may grumble and growl and leave. Some dogs may air snap. Some dogs may make contact. It's somewhat to do with the circumstances and that individual dog's history and personality. Dogs can be aggressive not only because they're fearful, but they may be guarding or resource guarding items that can sometimes lead to a snap and sometimes a pretty nasty bite associated with that. So the circumstances are really complex with regard to why that happened. And I know in a lot of cases where there's been a fatality, you often have a child who is not able to, they get very close to the face or defend themselves, or you may have an elderly individual or a physically disabled or unsteady individual who is not able to manage that situation. But I do think the fatalities are pretty uncommon, and there's some pretty unique circumstances that lead to that. But bites are not uncommon, and they're so some of the lower levels of aggression are not, that can lead to pretty significant injuries to small children because they are face to face with the dog who bites.
I guess I wanted to take a step back to even the report of when things come into the media and they're reported, right? So how it's reported, loving family dog, that doesn't give us a lot more information. It doesn't really tell us the conditions under which that dog was living. And I'm talking about all fatality cases, right? When we see this, loving family dog, well, define family dog. Is that dog truly a dog living within the home environment, or is that dog outside, more a resident dog? Those things are critical and really important, for socialization and as far as where we see severity. The other things that we don't know is intact. Could it be a breeding pair? There's a lot of factors that go on here that we just don't know in a blip of a news article, which it just doesn't give us enough information. But there's critical information that we would like to know to learn more. When you have two dogs in a home, obviously risk goes up a little bit, especially if they're, potentially a breeding pair, or they have resource guarding issues or issues amongst each other. That gets very frightening in homes with children, or even homes with seniors who can't help themselves. There's a lot of things that we need to consider and a lot of unanswered questions here that bring us, Sherry, to that. I want to know, I want to understand so that we can prevent and so that no one ever has to go through that again, because it is horrific. It is horrific. And that's where I do feel really confident that we do know with family dogs that are living in the home, that are included, that are surrounded, that are, a big part of our program that we talk about in the program is inclusion, to keep developing that familiarity bond so we decrease the risk of something so significant happening that can happen in novel situations or in situations where there's less socialization. So I just wanted to add that in there as well.
Details are important, aren't they?
Yeah, lots of details.
Understanding what happens with the setup.
Absolutely. Yeah. I get that. I thought it was important to talk about that a little bit because, to your point, a lot of these stories become sensationalized and we know so little. On the flip side of it, there are many laws and rules that are oftentimes unfounded, I would say, just because of labels that get applied in these circumstances.
They sure do.
And, that really frustrates me a little bit, but that's why I really wanted to convene and talk about this, realizing again that it's not common, but there are bites that happen frequently,
Yes.
more commonly. And I know I learned so much in your program, Jen, that we did together, things that you never think about until someone says, you really should think about this. Maybe this is a great time to have that conversation, in that we're heading into the holidays. As I said, it's a stressful time for everybody. We're having people in our homes, friends, family, perhaps gathering for parties or whatever else we may be hosting. I'm assuming this is equally stressful on our dogs.
Oh boy, Jill and I just had a great conversation about this the other day. It is equally stressful. I can't imagine. You put food, you have children, you have visitors, you have people who haven't seen each other for a long time. Sometimes you even have people bringing visiting dogs. You have a whole mix. And so we were talking about tips and strategies to help make that safer for families, like setting up kind of a game plan ahead of time, deciding who's going to be where. If you're going to be having children visiting. So for example, if someone has a newborn and they're so excited to come to Thanksgiving and they're so excited to share their newborn, at some point that newborn baby is going to sleep, usually probably in everybody's arms. But seriously, at some point, they may need to go and take a nap in another room. We need to be sure that the family dog or the dog that lives at that house or any dog visiting does not have access to that newborn. That all needs to be set up ahead of time. That's a safety measure that allows for us to make sure that there is full, awake, active, aware adult supervision, and that the dog does not have access at any time. Because the risk to a child, and this is really important, we know this for sure, the risk to a child that is visiting in a home and is not as familiar with that dog, and the dog is not familiar with the child, that raises the risk because there's novelty, there's not familiarity. And so we really do need to take extra precautions and steps. And the holidays are a big time where we see an increase in bites. I get it on the support line. And so I wanted to put that point out there that if you're going to be traveling and you're going to be bringing your baby, your toddler, think about your plan. Where are they going to be? Is there a dog in the house? How can you arrange that with the dog owners? What does that look like? Planning ahead goes a long way for these holiday trips. I'm sure, Jill, you have tons to add to that too. We talked.
I actually encourage many families to think about setting their pet up at home with favorite holiday treats or gifts and be prepared to welcome them when they come back, because it's a very stressful time. I think holidays are stressful in general, gathering a family and friends you may not have seen for a while. And there may be resident dogs. You may be bringing your dogs in. You have children involved as well. Really challenging for many dogs, even if they're super comfortable around super social, hyper-social dogs, around meeting unfamiliar people. You get a lot of things going on. And that pet may actually themselves feel more comfortable waiting at home for the family to return. The other is, as Jen mentioned, to be prepared. I love canvas crates or soft-sided crates. Have something set up in an extra room. Have that food toy set aside for when you're sitting down to eat, that your dog can go and relax and rest in that space. Jen's got
I've got goodies.
Jen, you brought up I think in Arch the other day a really, I thought, great idea is that one way the family can engage with the dog is the children could be potentially preparing those kongs or food treats. When the meal is being prepared, those kongs with dog food appropriate.
That's right.
To be put in the kongs and frozen so that the pup can have something to eat. But getting the pet out of the commotion, the people coming in the door and the children around the door, is just both for safety for the pet and safety for the child. I think is really, really important. And that does take planning ahead. It does take thinking about it ahead of time, because it's like everything just gets accelerated, doesn't it?
Oh, it
Sherry,
does.
it's the holidays.
It does.
Emotions and food and activity and crowd. And we call that trigger stacking. We all trigger stack, and our dogs certainly can do that as well.
And it is often the end of the day that I get calls onto the support line where there's been a bite or a growl and there's been an incident. And it makes sense. We're all trigger stacked at the end of the day. Everybody's tired. So allowing our dogs to have breaks during these times and giving them something, it doesn't have to be any kind of food dispensing toy, giving them something that they can go and enjoy and relax with. But scheduling those breaks for the family dogs, I think, is really important. A lot of people don't think about it. They think they're family. They should be here with everybody. But I need timeouts. I need a break from my children and family when everybody's home. So we have to think about it that way too.
Plus, they're dangerous foods that are dangerous for pets available, right?
I was just going to bring up,
get accelerated calls with regard to chocolate cake and cookies or other sweetened events, or turkey bones or chicken bones.
I was just going to bring up the buffet table, right?
Yeah.
So if you picture this, the buffet table, everybody's hungry. You're waiting for the food. The food's there and the dog is there. And if no one's planned for where the dog is going to be, this is going to be children, dog, people, everybody. So now what happens is if the child drops something or something falls under the table, now you have a dog under the table and potentially a toddler right there. That's a disaster waiting to happen. We can prevent these things by having the dog on the leash, making sure the dog is away from the food area, having the dog maybe at home, right, like Jill says, instead of even there. But having this, thinking it through ahead of time can make a world of difference for safety.
Yeah, my mind goes back to the program, Jen, of Sherry sharing some videos of parents going up and down stairs, training the dog to either stay at the bottom or go to the top and not be running alongside the human. I mean,
Right.
these are things that people take for granted that happen every single day in homes. And the risk that it presents, if it's a child in particular, I mean, not just the child, but the adults as well. We never stop to think about it. And so many of these things that we hear about are shoulda, woulda, coulda in the aftermath. And I think anything that people can do on the front end in terms of planning, as you say, is so critical to avoiding these events from happening.
Lots of prevention. I know it seems kind of hokey, but I sit down with my family and say, who's going to be doing what? I've always been a teacher. I've always had to manage a classroom or children or multiple households, with dogs. And it is something that my family does. Who's on what schedule? We have a puppy in the house and 2 senior dogs. And then I have college kids coming home, and it's chaos. And all the rules when new people are in the house, and people need to know this. When new people come to your house, your dogs know, ooh, I can do some other things. Like I can keep asking for that cookie on top of the refrigerator because David doesn't know 9 o'clock's my time. And that's when I get it. Like they know little tricks that they can do. So talking together, just one, so we can make sure dietary needs and restrictions are met. So nobody is having explosive diarrhea, so that we can make sure that everybody is on the same page. I don't know. That's how my family does it. We have a regroup. And if anybody's bringing a child, we talk about what that is going to look like. And then, where the dogs are going to be and what are the rotations out for the dogs. When and what treats do we have ahead of time for that? Who's going to be walking? We actually hired a pet sitter to come and do extra walks. So there's lots of things that a little bit of planning, because your holiday, whether it's Thanksgiving, Christmas, Hanukkah, any of these times, you want to focus on your family. Like you want to be able to focus on people, not worrying about your dog stealing something off the counter. So
that's what I tell my clients is in the same when a baby comes home, you need to be focusing on these events are really human-centric events because pets, dogs are such a huge part of our family life. We include them. We forget that they may not be enjoying that reunion. They don't see these people and these events as a comfortable event the way we are. And we're actually helping them by not putting them in these really stressful situations. We sometimes we're excluding them when in fact we're actually providing them a relief zone, a safe zone. Because you don't, with a child and a dog, you have to have some adult has to be 100% supervising. And then that takes that individual out of their ability to be preparing a meal, greeting guests, saying hellos, those sorts of things. It's just a really, really challenging and stressful environment.
It really is. I was going to mention some of the management options, so if you're traveling, and this is something that I think veterinarians, if your client has toddlers, asking them what their trips are going to be, where they're going to be going, because bringing a pack and play or bringing a play yard with you, not counting on the house that has a dog, but, bringing that with you. Say you're not bringing your own dog, but there happens to be a grandparent dog there. Knowing to bring that with you can make a big difference in that whole, the way everything goes. So just little reminders about what are you going to do to set it up for success for everybody, not just your dog, but for the dogs that you're going to be visiting. It can be helpful.
That's really, really helpful. And I like your comment, Jen, that those of us in the veterinary profession, I think, are in a unique position because we have contact with clients for other things, and bringing this up as a conversation.
Yeah.
Many times clients don't bring it up. They either don't think about it. They may be uncomfortable bringing it up. They may not realize that the veterinarian or veterinary technician has information that could be helpful to offer. And it really adds to the relationship I think we have with families and their pets to just bring those questions up. Hey, how's it going? What are your plans for the holidays? What is your dog going to be doing? Oh, a new infant in the home. Those sorts of family situations are wonderful adds because you can really be the initiator of that conversation, which is I see it as a personal touch of concern, and you're an incredible source of information to help send people to good sources of information about dog behavior, body language, safety, and encouraging appropriate engagement between children and pets.
Absolutely.
Well, and most veterinarians don't think about this. It not only benefits the welfare of the pet and the family potentially, but the fallout in these instances where a dog does snap or bite, that pet, we may lose that as a patient if that dog winds up being relinquished or given away. So, I mean, there are many ripple effects, particularly for our colleagues too.
Absolutely. Yeah.
Or they may come back to them and say, my dog bit, what do I do now? So understanding, then my first question would be, tell me about what happened. So courses such as what is being offered through VetVine or what Family Paws provides helps give back information, helps prepare the veterinary professional for questions to ask. I consider, dog behavior, animal behavior, our diagnostics is talk, it's questions. It's, I need to understand. I can't run a blood test usually. It may be part of an understanding, but my diagnostic tools are knowing what questions to ask, what points to try to figure out and help that family. And I find my clients they come to me with these questions are some of the most wonderful patients, most caring individuals. They're the most committed to their pets. And when we start to have bites in homes, we start to break the family bond, that human-animal bond, and that is the first step toward relinquishment. So as a veterinary professional, I feel like that's one of the things I'm passionate about is helping preserve that and improve it. And it's, it's a great way to start in building relationship with clients as well.
Definitely.
So, Dr. Sackman, aside from the physical barriers and separation and these other measures that we talked about, is there any place for considering situational meds for example, dogs that are anxious or known to maybe be a little reactive?
Sure, there are medications that family owners should check with their veterinarian on with regard to making the event a little less scary. Drugs like I use a lot of trazodone and gabapentin. I would not encourage people to give these drugs and allow their pet to wander with guests and children. But if the pet might be struggling with relaxing in a new environment, hearing people in the home and feel like they need to be part of it or afraid about all the people in the home, situational medications can be extremely helpful. And I might add one additional thing to this is sometimes also planning ahead and having your pet in a boarding facility or with friend or family member who's not participating in the event can also be extremely helpful. So don't forget that just having the pet in a more relaxed scenario, if they can't cope with being in the home, is also an option. But yes, absolutely, I would encourage pet owners to reach out to their veterinarian and for veterinarians to help these families, identify a medication. One caveat I have for that is let's practice and try it out before the real event to see how it works. So we're not trying a new medication during a holiday event and finding out it was not the best choice or the dose wasn't quite right. So it comes back to let's think ahead, plan ahead as best we can, plan for success.
I think just remembering that, our dogs get worn out too. They might like to visit with family and visit with people too, but it's our job to advocate for them and to remember that they have their limits as well. And just like we get very tired at the end of the day, they do too throughout the day. And the more that you can learn about body language, the more that you can learn and recognize how your dog is feeling in the moment. And that's really critical. So we encourage people to just continue staying curious. We know you know your dogs. Continue to learn your dogs.
I think that's a great summary, Jen. Our dogs have feelings too.
Yeah.
And we often miss it because they're not talking to us in a language that human has. They talk to us in body language. So.
And thank you for having us, Sherry.
Absolutely. I appreciate you joining and sharing your knowledge and perspectives. And thank you both for all that you do to help pets and their families. So important.
Thank you.